Start the demonstration of humerus. So this is a humerus, this is a bone of arm, this is a long bone, and now it has a three part: upper end, shaft, and this is the lower end. Upper end has four structure. This is a head is medially backward. This is a greater tubercle is the elevation of bone, that is called tubercle. So this is a greater tubercle, and this is a lesser tubercle. We can see a line between the tubercle, a groove type, that is called intertubercle sulcus, and also called bicipital groove. It has two lips and one floor. So this is a middle lip, this is a little lip, and this is a floor structure. So upper end, this is a lower hand, and is we can see there's a thin and triangular structure, and it has two parts: articulated part and non-articulated part. So this is a, what is it, this is a trochlea, a pulley shaped structure, that is called trochlea, and medial to the trochlea, little to the trochlea, this is a capitulum. So both are is a articulated part. Trochlea is articulate with the trochlear notch of ulna, and capitulum is articulate with the head of radius. So non-articulated part, this is a thin part of shaft, lower part of shaft is called supracondylar ridge. This is a lateral supracondylar ridge, this is a middle supracondylar ridge, and we can see that is a elevation is called epicondyles. This is a middle epicondyle, and this is a lateral epicondyle. We can see that middle epicondyle is very blunt, so we can feel it in middle epicondyle in our arm. And the importance of middle epicondyle is the posterior surface. The ulnar nerve is passes through the posterior surface of middle epicondyle. So we can see a fossa, that is called coronoid fossa above the trochlea. That is a fossa, that is called a coronoid fossa. And when we can see the posterior surface, so the above that fossa is called olecranon fossa, which articulate with the olecranon process of ulna. And that is a shaft. We can say the shaft, upper part of shaft is a round and cylindrical, and lower part of shaft is a triangular and thin. So shaft has a three border and three surface. So that is a anterior border start from the lateral lip of the intertubercle sulcus, and middle border start from the, that is a lesser tubercle. Middle border is start from the lower to the lesser tubercle, and lateral border. So lateral border, that is a lateral border. We can talk about the surface. So it has three surface: anterolateral surface, anteromedial surface, and posterior surface. Anterolateral, it means between the anterior and lateral border, that is called anterolateral. So this is the anterolateral surface, this is the anteromedial surface, and between medial and lateral border is called posterior surface. So this is the posterior surface. And what is the important of posterior surface? There is a groove. There is a groove like structure in the upper part of posterior surface of shaft is called a radial groove, where the radial nerve is passes through this groove. So this is all about the surface anatomy of radius. And when we talk about the applied anatomy or clinical anatomy of humerus, there is a three when if shaft fracture occurs from the upper part of humerus, then radial artery will damage. If any fracture of lower part of humerus, the is caused by